So today we're talking to David Holmes, who's the owner and chairman of the Ashcroft Group based in Hawley. David, the care sector has been under immense pressure during the recent coronavirus outbreak. You're very close to the situation, both as chair of the Surrey Care Association and through the 160 people your organisation supports. Could I ask you, how well do you think the care sector has responded to the COVID outbreak?
Hi, Nikki. Thank you. I think it's a great question, and obviously a very pertinent one given the press coverage that there's been on this issue of late. And I think my overall take is that actually the care sector has performed really well. And clearly I say that in knowing and acknowledging that there have been many thousands of deaths in the care sector. And clearly each of those deaths is a tragic loss and wholly regrettable. Each death is a loss to a family. And I think we need to absolutely respect those deaths. However, I also have a view that we need to put those deaths in context. You know, the social care sector in the UK supports over 1 million people, and the vast majority of those people remain well and happy, and have done so throughout this outbreak. I think there've been some numbers out this week about the number of care homes where COVID has found its way in, and that figure's about a third, which also determines that there are 2/3 of care homes where COVID has been kept out. And I think that we will see, when we look at some of the international comparators down the line, that the performance of the care sector in the UK has been relatively strong, and that we will see lower proportions of people affected by COVID in the UK compared to, say, France, Italy, and Spain. So I think there is a significant difference there. And I would also say actually that the number of deaths in care homes isn't really a measure of care home performance. That's a measure for me of government policy. You know, the timing of the lockdown was in large part the thing that determined how many people died in care homes. It's nothing to do with the way that those care homes have been performing. And as I said, I think care homes in general have performed really, really well. And I would say, how did they do that? Well, I think we saw it coming in the care sector. I think many care services locked down very early, and they turned their care homes into fortresses weeks before the government was imposing a general lockdown in society. And I think we planned and implemented well. We all improved our infection control regimes. We sourced our PPE, tough though it was. We paid the money and bought the PPE. And I would say the thing that we've had, the weapon that we've had better than any other, has been the quality of our staff. You know, our staff have been absolutely fantastic throughout this process. Our staff have been coming to work day in, day out. They've not been phased. They've acted professionally. They've just got on with the job in a really matter-of-fact way. And they've been there in the darkest hours. You know, they've been there sitting by the bedside as a second family member, supporting people through their darkest hours. And I cannot find the words to describe just how much respect I have for the social care, our social care workforce. They've been absolutely fantastic. So I have a really great deal of pride in the work of the care sector. I think people have performed remarkably in the very most challenging of circumstances.
And you've talked about your organisation, the Ashcroft Group. They support adults with learning disabilities throughout Surrey and Sussex. Looking at Ashcroft particularly, how well do you think they've responded to the crisis?
Well, you know, it's difficult, isn't it? Because you don't want to pat yourself on the back too much. We are here in the middle of May, and at this point in time, we have none of the people that we support with COVID. We've had a couple of cases over the last 6 weeks or so. Those people, thankfully, have become well. We've had a number of staff who've had COVID, but we've supported them to stay away from the service. So we're in a good position in the here and now, but clearly anything could happen tomorrow. And it is a really brutal virus, and it can find its way into any service. So So you can do what you can do, and you also need a dose of luck as well. In terms of doing what you can do, I think we've taken a whole raft of measures actually, and so we were planning for this from the start of March, and at that point in time we were talking about closing our doors. We stopped visitors to our services very early, and we insulated our services. They became, as I described earlier, fortresses. So we pulled up the drawbridge very early. And we're very fortunate in a sense that we don't have big 60-bedded units. We have small units of 4 to 6 beds, and so we've been able to isolate those units. We've stopped people working across the units. We've reduced our use of agency staff, and we've banned visitors. And so we've taken a range of measures to make those independent units very isolated, and that's been really successful. I think the other thing that we've done very positively is that we recognised at an early point that if COVID is going to find its way into our services, the strong likelihood is that it's brought in by one of our team, and that's a sad reality. So we invested a lot of time and effort into supporting our team members to stay safe, because if our team members stay safe, the people we support stay safe. And so we surveyed our team, and they were really great. They complied with what was a bit of a tricky request, really, and they told us lots about the way that they live. And so they told us if they were going to busy supermarkets 2 or 3 times a week, and they told us if they were travelling on public transport, on busy buses, and they told us if their partner worked at the NHS in a COVID ward. You know, we learned a lot about our staff, and through learning about our staff, we've been able to support them in a whole raft of ways to stay safe. So we've given people pool cards so they don't have to catch the bus. We've even financially incentivized people to shop online rather than going to the supermarkets. And so through those measures, I was thinking on one occasion we've given a member of staff some PPE to give to his wife, because his view and her view was that she wasn't being supported to stay safe at work. So through a whole range of measures, we've been able to keep our staff safe, and I think that's the key reason that we've had so few cases of COVID within our services. So I think we've done pretty well. The game's not over. It's only part done at this point, but I think through a great team effort and through the deployment of our brilliant staff team, we've managed to keep people pretty safe to this point.
That's great. And the tide does feel like it might be about to change a little bit. The country's moving forward, easing out of lockdown. What do you think are the particular risks to the care sector moving out of lockdown?
Well, so I have some nervousness. So it does feel a little bit to me like we've just kind of got through the first wave. I think the first wave in social care was a little delayed compared to the rest of society and the NHS. And it's only recently that the number of people passing away in care homes has started to decline. And so it feels a little bit early to be releasing lockdown in any way, shape or form to me. And the fact that that is now happening does create some significant risk. And the main risk is that people are out there again, you know. So firstly, some of the people that we support will want to be accessing the community, and they'll want to be back in the cafes, and clearly also the people that we employ, our staff, who have been so brilliant and vigilant to this point. They too will be out there meeting people, and with the best will in the world, that's got to happen, isn't it? People now have the freedom to go and meet parents that they haven't seen for weeks and weeks, and they will want to do that, and I absolutely understand that. So our staff too will start to mix with people in society, and that will create risk to them. So there is risk that both the people we support and our staff might bring COVID back into our services. And also there will be a whole raft of people who want to visit, who to this point haven't been able to visit. And so family members might want to visit. There will be kind of people in ancillary services like physiotherapists and district nurses and so on that might want to visit, and there might be maintenance work that needs to be done. So that there might be maintenance people that are visiting too, and even CQC inspectors, you know, might want to visit our services. So there is just a risk that more people come through the door. Now, the degree to which that creates risk for our services, in large part, depends upon how endemic COVID is in society. If the R rate, the fabled R rate, is very low, then maybe there isn't such a risk from those things. But if the R rate is high, and there are some areas of the country where it remains very high, then that's a big risk, and that feels too early. So I think there's just a potential that we're starting a second wave here before we've got through the first wave, and that's worrying to me. That feels like we've got over the foothills of the Himalayas, and all of a sudden we're now seeing Mount Everest towering in front of us. That gives me some concern. And you know, I think one of the problems here is that there isn't a plan. There isn't a plan at this point. There's very little guidance that's come from government to support the care sector in thinking about what needs to be done.
Thank you. So in terms of the immediate future and even longer term future, what do you think the Ashcroft group will be doing to mitigate those risks that you've just discussed?
Well, I think our message has to remain unambiguous. So Boris Johnson's coming for a lot of criticism about his recent messaging around giving up on the stay-at-home message and replacing it with a stay alert message. My view is that at Ashcroft we need to be unambiguous, and that our message has to be stay at home. For me, lockdown continues at Ashcroft, and I say that advisedly, and I say that respectfully of people's rights. Clearly, there are people that we support who clearly have the mental capacity to make those decisions for themselves, and we can advise those people, but we can't insist that they remain locked down. So we do have to just manage each of those situations individually and support people to stay safe who do want to go out. In terms of our staff, we can't stop our staff seeing their wider families and friends and getting out and about more, but we can deliver really positive messages to them about the importance of them staying safe, and that by virtue of them staying safe, they will keep our services safe as well. So I think there's a raft of messages that need to be given. I also think that the testing regime is really crucial. So at Ashcroft we have introduced weekly testing of our staff. Testing came into social care very late, only 2 or 3 weeks ago, but since that point we have been testing our staff weekly, and that feels really important. Testing is the one thing which brings COVID out into the open. It's the one thing that allows us to see it. And that weekly testing of our staff gives us a snapshot in time when we know that our staff team are safe and COVID-free or otherwise. And actually, what's really interesting is that testing has identified 2 people who are asymptomatic carriers of COVID, and we've been able to pull them out really quickly and get them to isolate. And fortunately, we've been able to do that before they've transmitted it to people within the services. So that, for me, demonstrates the absolute merit and huge importance of testing. So that testing regime needs to continue. We need to continue to source PPE, and that needs to be used properly within our services. I would like testing actually to be extended to visitors, you know. Wouldn't it be great if we had family members who could be tested before they visited, and then we would know that those visits were safe as well. But I think it's a risk, and I think all we can do as an organisation is keep things as tight as we conceivably can, make sure that there is no complacency that creeps in, make sure that people continue to work very hard to stay safe themselves and keep the people that we support safe too. And it's a critical thing, you know. COVID is a difficult foe. It's a killer, and if it gets into our service, it potentially kills people. So our ability to do this well really is a matter of life and death.
That's fantastic. Thank you very much, David, for your time.
No, thank you, Nikki.